Welcome to the main stage of Zasha Creative Conference. I'm Po Chin Lee, your host for the upcoming 2 days. In the upcoming 3 sessions, we're inviting several speakers to share with us their inspiring opinions on some of the frontlining issues. To start with, today we have Ms. Christina Ren to share with us her opinions and her insights on the emerging trends in genetic counseling and personalized medicines. Christina is currently the reproductive genetic counselor at Advocates Genetics, and she's also the author of Health and Wealth. Let's welcome Christina, and you may start whenever you are ready.
Hi, everyone. I can't see you, but thanks so much for joining in. I'm very happy to be speaking here with you today. So as mentioned, my name is Christina. I'm a genetic counselor. And today I'm going to be talking about the emerging trends in genetic counseling and personalized medicine. And I want to highlight sort of just a few trends in genetic counseling and personalized medicine and where I think, the future is headed. And this is meant to be really a high level overview because as I understand, the audience is pretty diverse today. So the other thing about genomics is that it's evolving so quickly that it's sort of a moving target. So it requires this sort of constant iteration, push and pull in finding this intersection between what's scientifically possible and ethically feasible. So my hope today, by the end of this talk is to convince you how important the role of genetic counselors are in this growing field. All right, so, I know that I've been already introduced, but just some context here. I went to Stanford for undergrad studying biology, and I realized that genomics was where I wanted to dedicate, my life's work to. So I became a genetic counselor to pursue sort of this connection between the cutting edge of genomics and the humanity of counseling patients. So during grad school, I had a lot of clinical and industry training in various places, including UCSF, Kaiser Permanente, Natera, and a top-rated fertility clinic for Pacific Fertility Center. And so really working with over 100 plus patients has really grounded me in how innovation needs to create real value for patients rather than just, existing for the sake of innovation. And most recently, I was also employee number 2 at Orchid Health, which is an early stage reproductive genetic startup based in San Francisco. And so I used my genetic counseling background to communicate our product and story to prospective couples, media outlets, and clinical partners. So enough about me, let's get into it. So stepping back, just think about big picture. Genomics as a whole, just to kind of, give you a sense of timing of where we are at right now. I think, we're still at the early stage in this field. There's a really long-term future and trajectory going forward. I included this S curve because I think we're really at this inflection point in which, the pace will only continue to accelerate over time. And that's driven by a lot of different factors. There's the drop in cost of genomic sequencing. There's increased number of genetic tests that are being offered. There's improvements in interpretation tools to help us better analyze what genetic variation actually really means and how that correlates to human health. And so all of those combined together make it so that we're sort of at this cusp of putting everything together. So definitely a very exciting time to be part of this field. All right, so some context. I think one of the most common questions that I get at parties when I say that I'm a genetic counselor is, what exactly is genetic counseling? So depending on who you're asking, you probably will get different answers, but this is how I like to distill it down. So genomics itself is pretty new. So naturally, genetic counseling as a profession is also relatively new. Most people are just not aware of it as the same way they are as if you say that you're a surgeon, for example. But I like to sort of define genetic counselors as master communicators of complex information, and also facilitators of complex human emotions. And so in the clinical setting, what that means is if you go and see a genetic counselor, how they can help you is, for example, they can talk to you about your genetic risks, and they can explore what types of genetic testing may be right for you. If you do end up doing testing, they can discuss with you what your genetic test results actually really mean to you and your family, and whether this information actually impacts your medical management or reproductive decisions. So, with all of these rapid changes in technology, it's interesting to note that what doesn't really change and is at the heart of genetic counseling is, the human nature and human psychology remains the same. There will always be uncertain and difficult situations to face. And our role as genetic experts and guides will really only continue to grow and expand over time. And I think something that's vastly underrated in the healthcare community is clear communication and genuine empathy for others. And that's at the core tenet of what genetic counseling is. So, at the end of the day, genetic tests are just tools. They're just a way to get more information. But what matters is how people actually make meaning of this new information that's being thrown at them, and what the numbers on these reports that they're getting from labs actually mean. And so that's what genetic counselors critically do, and why, I think we're irreplaceably important. We're just essentially at this crossroads, and we're uniquely equipped to help, individuals conceptualize risk based on a patient's past experiences, what their needs are, and just really meeting where they're at. So I think it's a combination of this new genetic information and this, unique, personalized, individualized care of genetic counseling that makes it so that we contextualize the meaning for the patients to actually understand and do something with the information that they're given. Okay, so there's actually many fields and roles in genetic counseling. It's quite a diverse profession. I'm right now describing what it looks like in the United States because that's where I'm from, but it could be a totally different story in other countries. So can't speak to every place. But in the United States, the largest specialty areas are currently cancer, and where 30% of the genetic counseling profession is in the cancer field, and also prenatal genetics. That takes up about 20% or so. Now, some growing and emerging fields include cardiology, direct-to-consumer, pharmacogenomics, genetics, and also preconception and fertility. There's also, genetic counselors work in a variety of different settings, from universities to hospitals, laboratories, nonprofits and governments, recently some startups, as I'm a case in point. So yeah, there's a lot of different areas and where genetic counseling is sort of being applied, and genetic counselors are sort of out in the wild. All right, so now with that context in mind, let's go into 3 emerging trends in clinical genomics that I actually think are going to be in our horizon in the next couple of years. And first of all, this is by no means comprehensive, so don't be disappointed and ask me like, oh, what about this? There's a lot of different players in genomics. So these are just things that I happen to have some degree of insight on and also can speak a little bit on. So first is how liquid biopsies are evolving to become first-line screening and diagnostic. So liquid biopsy, I mean molecular level analyses of bodily fluids like blood, saliva, urine. Number 2 is increasing awareness and access to IVF and pre-implantation genetic testing. So, for patients that undergo in vitro fertilization, they have this option to genetically test the embryos created in the lab before, transferring it back into the woman's uterus. And let's see. Yeah. And then so the third trend that I was going to talk about is the integration of monogenic risk variants with polygenic background. So what I mean by monogenic is a disease that is impacted mostly by a single gene. Polygenic, what means that likely a variety of different genetic factors and across many genes across the genome impact your risk for developing a condition. All right, so I'm going to be diving into a little bit of each one of these trends just to sort of give you a little bit more color into it, but it still remains pretty high level. Okay, so liquid biopsies, why liquid biopsies? Why is it important? Why should we care? So the problem right now is that a lot of current diagnostic tools are really expensive and sometimes really hard to access. If you think of, for example, imaging technology, MRI or CT scans, or prenatal diagnostic procedures like amniocentesis or CVS, they require trained professionals, laboratory equipment, oftentimes are done in large hospital institutions. And so if it may not be readily accessible to people, for example, that are lower income backgrounds or just living in rural areas and don't easily have access to large hospitals. So the liquid biopsies provides this opportunity to lower potential costs and increase access. And the reason behind that is just simply because, it's much easier to do, for example, a blood draw or, a saliva sample or a urine sample than to do any of these really high scale, high cost diagnostic tools I was just mentioning. So liquid biopsies can be used in a variety of different applications. But I'll mention two examples where essentially they've already become sort of mainstream, widely adopted, at least in the United States. The first is non-invasive prenatal testing, otherwise known as NIPT. And the second is a little bit more emerging and new, so it's not yet widely adopted, is multi-cancer early detection blood testing. So talk a little bit more about that. So NIPT is interesting because it has a really short history and is an example of how things come about faster than you might think. So NIPT, it was commercially introduced in 2011. And since then, it's really sort of taken the prenatal care in the clinic by storm and now is being widely adopted. ACOG, which is the American society that makes a lot of these genetic guidelines, now thinks that it's a universal screening option for any pregnant woman to assess for chromosomal abnormalities. So I don't want to go too much in the weeds here of this slide, but this is just to illustrate that things go really quickly, actually, when the technology and the market fit works. So that's a case study on NIPT. And so, yeah, the impact of NIPT adoption in clinical practice is seen widely now, at least here. And, right now it's routinely ordered by gynecologists for pretty much any pregnant woman that wants the screening. And it's really fundamentally changed a lot of prenatal genetic care. And anecdotally, I can tell you that it has increased, access to prenatal testing in so much that, now large institutions, their volume for amniocentesis and CVS has actually gone significantly down because now more pregnant women are just opting into doing this simple blood test and blood draw instead of doing amniocentesis, which involves this long needle procedure to go through the abdomen to collect the amniotic fluid. So example of liquid biopsy, successful example. Now, I believe actually there would be a similar transition that can and probably will happen for cancer blood tests. So similar scientific concept where essentially the blood test will look for floating pieces of cancer DNA in the bloodstream. And the goal is to try to detect cancer earlier when it can be cured and to improve patient outcomes. So very similar technology as NIPT, but just used in a different application. As I just mentioned before earlier, it's still in the early days of adoption within the clinics itself because it's a relatively new product. But I think the transition will, again, as NIPT has shown us, will happen faster than we might think. No affiliations with this company, by the way, but Grail, which was recently reacquired by Illumina, is an example of a company that's doing just that. Right now, they have a product and test that is able to screen for up to 50 different types of cancer to detect early signs of cancer for patients that are, I believe, over age 50. Okay, so the second trend that I want to touch on is because I'm a reproductive genetic counselor, is pre-implantation genetic testing. So there is this growing trend of actually rising interest and adoption of pre-implantation genetic testing, otherwise known as PGT. And here are some numbers within US IVF fertility clinics. So you can see that over the just course of 6 short years, there's been an 8-fold increase in the percentage of IVF cycles that have, some form of PGT that's been done with that cycle. So now the latest data that we have is in 2018 with the final data. And we know that 40% of all the IVF cycles done by patients include some form of genetic testing on the embryos. So that goes to show you that embryo selection and transfer, based on the results of these PGT, is receiving a lot of attention, given its potential benefits for, the patient clinical outcomes. And it's actually interesting when you compare that overall growth of IVF, which has only increased about, 1.5-fold or so over the past 6 years. It's steadily increased the use of IVF, but what's even more striking is this growth in specifically genetic testing in the IVF world. Again, I think that genetic counselors are uniquely positioned to be an important role within reproductive medicine space. I have previously, talked to a lot of IVF doctors, including medical directors of IVF clinics. And I can tell you that they're all very busy. And they have admitted that it's a challenge to build in time to do this type of counseling that's involved with sort of this decision-making around, for example, which embryos they should prioritize to transfer first. These are actually quite difficult questions to answer. And I think genetic counselors are uniquely positioned to do just that because that's our job. But at the same time, I think there's still a long way for us to go, considering that there's this critical need that's not being met. And what I mean by that is that most IVF clinics, at least in America, don't employ an in-house genetic counselor. So, every IVF clinic might have physicians, nurses, embryologists, but they don't have their own in-house genetic counselor. And so that means that, patients sometimes they don't even interact with genetic counselors while they're going through IVF and genetic testing. And sometimes patients have to really struggle with questions like, which type of embryo should they consider, transferring first? Oftentimes they make these decisions without complete information and counseling. So there's this area and opportunity for genetic counselors to really step in and step up, honestly, to provide that for them. And the last piece that I want to just talk about is polygenic scoring. I don't know how familiar you might be with polygenic risk scoring or polygenic scoring, but sort of the high level is, what is polygenic risk score, otherwise known as PRS? It's essentially a way to quantify the risk, the sort of genetic risk for common diseases. What I mean by that is, okay, let's say that what's an example of a monogenic disease? That would be cystic fibrosis, for example. There's one gene involved, and that's pretty much it. Whereas for a lot of different chronic common diseases, for example, coronary artery disease, that is a complex polygenic disease where there are a lot of different genetic factors in play. And we're just beginning to understand it and be able to quantify it. And what a polygenic risk score does is actually just goes and weighs all of these small little factors, which combined can help predict, which combine into one single number, basically, can help predict complex disease risk. And so you can see, and you can imagine how this could be useful for population screening, where, here, for example, you're seeing that, for a given disease, that maybe average population, within a given population, they have, average risk, but there are a certain percentage of people within the population that have very high risk of potentially developing these diseases. And we, some previous studies have shown that polygenic risk scores for common diseases like breast cancer, coronary artery disease, type 2 diabetes can now substantially identify a much larger fraction of the population than is found in the rare monogenic mutation or rare genetic diseases category that I was just mentioning, at a sort of comparable or greater disease risk. Yeah, but PRS is still really new. There's a lot that we don't know, and there's a lot of limitations. And so, but sort of to highlight, what can we do with this genetic information? Well, one is that we can potentially inform better clinical management. So screening, preventative measures, be able to predict treatment response, and also personal health behaviors. So if, for example, you found out that you have a higher risk of coronary artery disease, you would probably be more motivated to improve your lifestyle modifications. So hopefully the idea of PRS is that it can improve health outcomes, or at least that's the sort of thought or hope. And understanding your risk better, improved decision making, and also earlier diagnostics and treatment. Let's see. Okay, so now the critical question really about PRS is actually, how is it being received by individuals? So a lot of attention and debate within scientists, layperson, and clinical genetics people has actually been focused on sort of the technical feasibility of PRS, asking questions like, okay, well, how is PRS being generated? What's its predictive ability? What are its applications? But I think actually equally important, and tying it back to genetic counseling, is this question of how do we actually how does this new type of genetic information being communicated with people, and how do individuals respond to the knowledge of their probabilistic susceptibility to disease? Because again, we're talking about probabilities here. It's not a binary yes or no answer. Yes, you're definitely going to have heart disease. No, you're definitely not going to develop it. And so there's this concern, especially I think within clinical genetics, about people sort of misinterpreting their PRS results, where there's this fear that hypothetically, if you, for example, receive a low risk result, then someone might say, "Oh, cool, I'm off the hook," and then proceed to sort of forego or be a little bit reckless in terms of their health behaviors. And conversely, if you're told that you have a high chance of developing heart disease, the fear is that, well, some people will really freak out and say that, oh, I'm definitely going to develop heart disease and I'm doomed, kind of thing. So I think these are theory. We don't know the answers to this yet because it's still a lot of it is being developed, and we don't quite. It's still on the cusp and bleeding edge, really, of genomic medicine. But I think the question would be to ask and try to understand better: is this actually true about how people respond? Is this sort of misinterpretation of information actually really true? And that's an interesting question. All right, so the other thing I wanted to sort of paint a picture was actually, I think this growing debate about monogenic, polygenic became this sort of two camps of people that have really desperate ideas about where clinical genetics will be. And in reality, I actually think that these two forms of looking at our genetics is not mutually exclusive, and likely there's probably additive interaction and also synergistic interaction between the two. And so it's not inconceivable in the future that the two will sort of meld together, and there will be a sort of combination between looking at both the monogenic and polygenic risk for personal evaluation of someone's risk. So we are already seeing that in examples of a study. So here is, I pulled this out. This was just published last year by a group, I believe in Broad and MIT Harvard group. And they found, interestingly enough, that patients who have a BRCA1 mutation or 2 mutation, for example, so we're talking about cancer susceptibility genes here. So, patients that have BRCA1 or 2 mutations, they have increased risk for breast cancer. But we're finding out that actually, if you layer on top of the polygenic risk, then actually the probability of breast cancer can vary a lot. If you have a BRCA mutation and you have a low polygenic risk score, then your probability and your risk of getting breast cancer can be as low as 13%. Meanwhile, when you have a mutation and plus a sort of a double whammy, plus you have the polygenic high risk, then that risk can go all the way up to 76%. Same thing with Lynch syndrome mutations. These are a certain hereditary colon cancer, where we can see this large variability in spectrum. So in the future, I don't think that it's entirely impossible that if someone has a BRCA mutation or any sort of cancer mutation, that the follow-up question would naturally sort of point towards, well, do they actually also have a high or low polygenic risk? And the answer to that question can help further refine their risk of developing certain types of cancer. And it could be much lower or higher than we had previously expected, or might be quoting to them to this day in clinic. Genetics is rarely a guaranteed outcome, and this is an example of what that means. All right, so what do we do about polygenic scoring as genetic counselors? So I have, my ears peeled in terms of the community, and many genetic counselors are hesitant and worried and skeptical about what this will mean for their practice. And, I really just returned to a similar slide that I just showed you earlier, which is that actually, I think the principles of genetic counseling still apply here for polygenic diseases. And polygenic testing, at the end of the day, still just remains a probabilistic risk factor tool. And genetic counselors will help make meaning of these numerical risk estimates, because we're trained to do that. We're trained to talk about these probabilities and risk estimates. And that's, I think, pretty much it. I think, just to recap, We talked about how genomics is still in its nascent stage. There's still lots of opportunities for growth, for innovation, for startups to come in and make a difference. Genetic counselors are master communicators, which I hope that I have represented the profession in a good light today. And also I talked about 3 emerging trends that I believe will really shape clinical genomics in the next coming years: liquid biopsy, pre-implantation genetic testing, and polygenic scoring. And that's pretty much it. So thank you so much for tuning in. Again, my name is Christina Ran. If you enjoyed listening to me just now ramble about my thoughts, maybe you might be interested in checking out my writing. It's essentially an email newsletter. So if you click in healthandwealth.substack.com, you can sign up and you can subscribe. And which means that you'll get my writing pretty much, I try to do it weekly. You'll get my writing in directly into your email inbox. But yeah, thank you so much for your time and attention. It means a lot to me. And again, yeah, if you have any questions, feel free to reach out.
Thank you very much, Christina, for your awesome sharing and your insightful opinions on what genetic counseling is currently dealing with is very eye-open leading. We are now dismissing the session, and please be reminded that we will start our next session in the afternoon at 3:30. Please be right back.